Stop right there. Before you reach for that fish medication, watch on. This video is packed with everything you need to know to treat your fish safely and effectively. We're tackling a crucial aspect of fish keeping, recognizing and responding to signs of fish illness. With the right knowledge, you can make informed decisions that could help save your aquatic friends. Let's dive in. Diagnosing the problem correctly is crucial before you even think about treatment. Incorrect medication can do more harm than good. Jumping to conclusions about your fish's health can lead to more problems. Here's why getting the diagnosis right is non-negotiable. Treating for the wrong disease not only wastes time and resources, but can stress your fish further, lowering their chances of recovery or increasing the chance of death. Incorrectly using antibiotics or other treatments can lead to resistance, making future outbreaks harder to treat. Every medication affects your tank's ecosystem. Chemicals can harm beneficial bacteria and other aquatic life that help keep your aquarium clean and inhabitants safe. So, what should you do? First, observe your fish closely. Note their symptoms, behavior changes, and any recent tank modifications. Then, research these symptoms or consult with experienced fish keepers online or in local communities. Remember, accurate diagnosis often requires understanding the specific needs and common issues of the fish species you're keeping. Only after you've gathered enough information should you consider treatment options. Let's talk about treatments, focusing on what you can do without causing harm, especially when professional help is not an option. First, test your water parameters. Ammonia, nitrite, nitrate levels, and pH balance can impact fish health. Correcting water conditions can often alleviate stress and disease. This may be as simple as taking a water sample to your local fish store if you don't own your own test kit. You may discover the solution to your issue is just a simple water change or alteration. Isolate sick fish if possible. A quarantine tank prevents the spread of disease and allows for targeted treatment without affecting your main tank. This may be necessary if you have a planted tank, for example, and would like to dose with salt. Plants do not tolerate high levels of salt, so you may want to confine the affected fish into a separate holding tank. This can also reduce cost, as less meds may be required if using a smaller quarantine tank than your main aquarium. For certain conditions, like parasites and mild fungal infections, salt baths can be effective. It's used globally as it's commonly available and effective. However, ensure the species of your fish can tolerate salt and follow guidelines strictly to avoid stress. For more specific treatments, it's crucial to match the medication to the confirmed diagnosis. Use medications as a last resort and follow the instructions to the letter. Over-medication is a common mistake that can lead to complications, such as oxygen depletion or even death. Certain medications will require you to do things like provide extra oxygen to the water, which can be done via an air pump and air stone or by adjusting your filter's output to create ripples on the surface. They may also require you to do a water change after a period of time's passed. The best treatment is prevention. Regular maintenance, quarantining, proper feeding, and monitoring your tank environment can keep your fish's immune system strong and prevent most diseases from taking hold in the first place. Let's go through a quick diagnosis guide, covering the 10 most common signs of disease or illness in fish. Identifying these signs early can be crucial for the health of your fish. This guide is a starting point. Always follow up with thorough research or consult a professional for an accurate diagnosis. Small peppered grain-like dots on the skin, gills and fins often indicate a disease, commonly known as ick. It's a parasitic disease that requires immediate attention. White or greyish fluffy growths on the skin, mouth or fins suggest a fungal infection. These infections usually occur on damaged tissue or in fish with compromised immune systems. Visible red or bloody streaks on the body or fins can be a sign of septicemia, a bacterial infection in the bloodstream, often caused by poor water quality. Especially with scales sticking out, can indicate dropsy. It's a symptom of internal problems such as kidney failure or bacterial infection, and not a disease itself. Fins held close to the body, not fanned out as usual, are a sign of stress or discomfort, which could be due to various environmental factors or diseases. Excessive or rapid gill movement may suggest the fish is struggling to breathe, possibly due to poor water quality or a gill infection. A sudden lack of interest in food is a common sign of illness or stress in fish. Unusual swimming patterns, such as spinning, swimming upside down or crashing at the bottom, can indicate neurological issues or swim bladder disease. Significant fading or darkening of colours might be a stress response or a sign of illness. Cloudy, bulging or sunken eyes could suggest an infection or poor water conditions. These signs can help you spot trouble early, but diagnosing fish diseases requires a nuanced understanding of their causes and treatments. Always cross-reference symptoms with reliable sources and consider the context of your aquarium's conditions. Even with the best care, emergencies can happen. Recognizing and acting swiftly in these situations can be the difference between saving your fish and facing a much more dire outcome. Here's what to do in emergency situations. First, quickly assess the situation. If a fish is showing severe symptoms or behaving erratically, isolate it in a quarantine tank if possible. This can prevent the spread of disease and makes treatment easier. Immediately test your water parameters. Many emergencies stem from poor water conditions. Ammonia spikes, drastic pH changes, or elevated nitrite levels need urgent correction. In cases of suspected oxygen depletion, increase aeration in the tank immediately. An extra air stone or increasing the output of your existing system can help. Utilize online forums, local fish stores, or emergency veterinary services that offer real-time advice. Communities like on Reddit or specific fish-keeping forums and Facebook groups can be invaluable for quick advice. Having an emergency kit prepared can save valuable time. Include water conditioners, test kits, common medications, and any tools that might be necessary for treating injuries or diseases. Document symptoms. Take notes or pictures of the symptoms. This documentation can be crucial when seeking help from professionals or experienced fish keepers online, allowing them to provide more accurate advice. The goal in an emergency is to stabilize the situation. Long-term treatments or diagnoses can follow once you've ensured the immediate safety of your fish and tank environment. Finding an aquatic vet can be like searching for a needle in a haystack. That means the bulk of your fish's health is in your hands. Equip yourself with knowledge from reputable sources. Not all advice online is gold, but many can offer help. Beware of misinformation. Always cross-check what you find. Feel free to drop your questions or share your stories in the comments. If you appreciated this guide, give it a thumbs up, share it with your fellow fish keepers and hit subscribe. More insights and tips are on the way.